Good afternoon, and thanks for joining us today for our webinar, Returning to Work After an Injury, How Employer Accommodation Programs Can Help Employees. All right, my name is Jonathan Ferguson. I'll go into a short intro just a little bit later, but I want to thank you again for joining our webinar brought to you by the Retirement and Disability Research Center. This webinar is being recorded, and the recording and slides will be posted on our website in just a few days, most certainly by the end of the week. And you'll also receive a follow-up email within a few days with a link to the recording. My name is Jonathan Ferguson. As I mentioned, I'm a financial capability specialist with the Retirement and Disability Research Center here at the University of Wisconsin-Madison. You'll see our agenda for today on the screen. We'll have our short welcome and intro, which is what we're doing now. We'll have three separate presentations, one to present and review the research, finding the backgrounds, methods, and just a study overview. And then we will have two discussants, one to focus on policy implications, and then another to talk about practice, context, and place this study within context there. We'll then have a short Q&A session, and then we'll sign off in about exactly 1 hour. All right, so to get started, I'll introduce our webinar presenters. First, we have Marcy Hintzman, who is a project coordinator at the Great Lakes ADA Center. Marcy coordinates the Trainer Leadership Network program, develops and conducts training on various aspects of the Americans with Disabilities Act, ADA, and provides technical assistance on the ADA for the center. Marcy has over 25 years of experience in the disability field. She obtained her bachelor's degree in psychology from Purdue University and graduated with her master's degree in rehabilitation counseling from the State University of New York at Buffalo. So thanks to Marcy for joining us today as our practice-focused discussant. Second, we have Dr. Seth Seabury, who is the director of the Keck Schaefer Initiative for Population Health Policy at the USC Schaefer Center and associate professor in the USC Mann School of Pharmacy and Pharmaceutical Sciences in the Department of Pharmaceutical and Health Economics. His work examines the impact of legal and regulatory policy on healthcare delivery and patient outcomes, with a particular focus on at-risk and underserved populations. Dr. Seabury holds a BA from Kenyon College and a PhD from Columbia University. And then next, Stephanie Renane is an economist at the RAND Corporation. As an applied microeconomist, her research interests fall at the intersection of labor and health economics, and she has particular expertise in the area of disability policy and related health and social insurance programs. Thus, a great person to talk about our topic here today. She holds a BA in economics from the University of Michigan and an MA and PhD in economics from the University of Maryland. And so with that, I will turn things over to Dr. Renane.
Thank you, Jonathan, and thank you so much to everyone for being here today. I'm going to be presenting an overview of our paper. It's a collaboration with my co-authors, Naoki Ozawa and Karina Momertz. Both of them are online today and will be helping to field questions in the chat. So we're really interested in this paper on understanding how accommodations provided by an employer can help individuals return to work after they experience an injury or disability in the workplace. But to begin, I want to take a step back and think a little bit more broadly about there's many life events that can affect an individual's ability to work. We're interested in this context here and thinking about health and disability, but there's also events like layoffs, or an individual might experience other caregiving needs that could take them away from work for a shorter or longer period of time. And we can think about the role of the employer in a lot of these contexts. There's a lot of forms of support and benefits that an employer can provide to help workers navigate these life events. So some common examples are things like health insurance, paid leave, And so we're thinking of accommodation broadly as another example of this type of support that an employer can provide for certain circumstances as needed. But it's really important to think about it in this context because not only do we need to understand how a worker responds to these life events, but we also need to understand that the ways that the employer might respond, or the way that they, what their behavior is in response to these events, when we're thinking about the right way to design supports for workers and social insurance programs to support these workers through these life events. So, as I said, in this paper, we're really focused on thinking about workplace injury or disability events and understanding the role of firm accommodation after these workplace injuries. So our paper seeks to answer two main questions. The first is, does firm accommodation improve worker labor market outcomes? The second question is, do employers have appropriate incentives to provide the right level of accommodation? I'll just say right here, in the interest of time, I'm going to be focusing primarily on that first question today, but I'll provide a quick summary at the end on some of the things that we're seeing in response to the second question as well. So before getting too far ahead, I just want to be clear about the definition of accommodation that we're using. Here we're defining accommodation as any adjustments to the work environment that enable an individual with impairments to be able to work. You can think about this broadly. This could be providing special equipment to someone. It could be offering them trainings to kind of do other activities that maybe they weren't originally trained to do. It might be offering them flexibility in their work schedule so they can work at different times or maybe in different locations. So it can be a variety of things, some, which have larger costs to the employer and some maybe not as large of a cost. But a common theme of all of these things is that they're supports or adjustments that allow workers to stay engaged in the labor force when they have a disability or while they're recovering from some kind of shorter term health event. Some of these accommodations may actually enable the workers to develop new skills if they're doing training to kind of learn about different job activities that they might have to do, or it might offer them opportunities to enhance their existing skills. So these can be benefits for the worker, and they can also have benefits for the employer if now they have workers that are a little bit more flexible or have different skills than they did before. So we're not the first people to think about accommodation as an important lever that might be able to help workers who have disabilities. There are several policy proposals that have been initiated and suggest subsidizing employer accommodation for workers as a way to kind of improve these outcomes after disability. So the Otter and Duggan proposal we mentioned here is one of a few that kind of point to this as a potentially useful policy lever. So in our research setting, we're going to focus on one particular setting, which is the Oregon workers' compensation system. So in general, workers' compensation is a state-based and social insurance program for individuals who are ill or injured as a result of something that happened while they were at work. Workers, when they experience one of these events of illness or injury, can file a claim, and they receive benefits as a result. They have medical coverage that covers all the expenses associated with that disability. And if they need to be out of the labor force for a longer period of time and they can't earn their normal wages, they can receive cash benefits during that period of recovery, or in some cases, even a permanent payment. In all state, or nearly every state, there's, I think, 2 states that are an exception at this point in time. Workers must buy employers must buy workers' compensation insurance from a third party, or they must self-insure and kind of fully cover the costs of workers' compensation in the event that one of their employees has a workplace injury or illness. So we're interested in Oregon's workers' compensation program because it has a fairly unique program called the Employer at Injury Program. I'm going to probably refer to this as EAP going forwards. It kind of rolls off the tongue a little bit easier. EAP is an optional benefit for employers in the workers' compensation system. What it does is, if employers provide accommodation to workers with an active workers' compensation claim, they can receive a wage subsidy for a set period of time after that, kind of during this recovery period. And they can also receive reimbursement for other expenses that they might have had to incur in order to accommodate workers. What do I mean by an active workers' compensation claim? This applies to workers who, experience a workplace injury. They still have some restrictions on the activities they're able to do, so they can't fully return to the types of job that they had before. But they could return in a modified capacity to maybe do something else as they continue to recover. So for workers who are kind of in this kind of intermediate phase, the employer can offer them a transitional opportunity. And the wages paid during that transitional opportunity or other expenses they need are the types of things that could be reimbursed by EAP. So there's benefits to the worker because they can return to work and, kind of earn wages during this time. There could be benefits to the firm because it reduces their workers' compensation costs if now the person isn't receiving benefits and instead they're working. And it can also make them a little bit more productive because now they have another worker back doing something for the firm instead of, recovering while they're out of the labor force. The wage subsidy part is the most popular part of this program. We see about 90% of expenses in EAP are expenses for the wage subsidy component rather than the reimbursement for other expenses. That subsidy rate was set at 50%, but in January 2013, it was reduced to 45%. And that's going to become important for our research design, which I'll get to in a little bit. So our main data source is going to be administrative records from the workers' compensation system in Oregon. We're really grateful to the support and collaboration of the Oregon Department of Business and Consumer Services, who's been really integral in helping us access this data and understand this data and work with this data for a number of years. So I do want to thank them for their support. We use closed workers' compensation claims, which have really detailed information on characteristics of the worker, characteristics of the firm where they were employed before they were injured, and just descriptive characteristics about their injury, what body part was injured, what was sort of the nature of their injury, what costs have been paid through the workers' compensation system to cover the injury, that sort of thing. We also have measures of whether or not a claim had any expenses that were reimbursed through the EAP program. So we know whether they participated at all, whether they had wage subsidies or other expenses. So with the help of our partners in Oregon, we were able to link this data to earnings records, both before and after injuries. And Oregon is one of the few states that also has information about the number of hours worked. So we can see both quarterly earnings and quarterly hours for a long series before and after injury. Our primary sample is going to be claims that happened between 2011 and 2017. And we're going to restrict our sample to full-time workers. We're also going to restrict our sample to firms that we see in the data set multiple times. And that's, again, a function of our research strategy, which I'll explain a little bit more in a minute. So let's move on to the first question. Does firm accommodation improve labor market outcomes for workers? In case you get bored or have other things to do, I'll just tell you a quick answer up front. The answer is yes. The main method we're going to use to get to this is sort of a quasi-experiment, taking advantage of the fact that the value of this subsidy changed in 2013, as I mentioned before. So let me get into a little bit more detail on what exactly our strategy is. So we know that this subsidy changed in 2013. The challenge is that this sort of changed statewide, meaning that any firm or any employer that has a claim happen through workers' compensation can take advantage of it. So there's no obvious control group or people who are unaffected by this change. But what we do instead is that we observe in our data that there are firms who use this accommodation program more or less frequently. And so we kind of translate that into what we're calling a measure of exposure. And we seek to identify firms who have a lot of use, who are very highly kind of exposed to that subsidy change when it changes, and then firms who have very little use. So once we kind of define this measure of how often firms are using this program, we kind of look before and after this policy change and interact our measure of exposure with this change in the subsidy to see how accommodation outcomes change when the subsidy is reduced, and also how employment outcomes change. So that kind of variation allows us to see what is the impact of the subsidy on use of accommodation and these other downstream kind of employment outcomes. But we also want to know, the answer to our research question is, what is the effect of accommodation on employment outcomes? And so then in a second stage, we use this exposure measure interacted with the subsidy to predict accommodation, and then look at the impact of accommodation itself on those employment outcomes in an instrumental variables approach. So in the interest of keeping an overview, I'll try to not get too far into the specifics, but happy to elaborate more in Q&A on some of these details. But first, I do want to spend a little bit of time explaining this exposure measure that I mentioned before. So what we do in our data is we kind of set two distinct time periods, one which we call an exposure measurement period from 2005 to 2009, and then the analysis period, which I mentioned before, from 2011 to 2017. During this measurement period, we examine how frequently firms are using the EAP program. And we essentially calculate, out of the number of claims that we see for any firm in this period, how many of them had any expenses reimbursed through EAP. And so that could range from 0 if none of the claims had any EAP expenses, all the way up to 1 if every time there was a claim, the firm was kind of getting a reimbursement. And then we take that exposure measure that we calculate from this period prior to our analysis, and that's what we use to define how exposed the firm is in the analysis period. And the thought experiment here is that, if we see a firm with very little use of the past, they're going to be less likely or highly unlikely to respond to a change in the subsidy, in particular in this case, because the subsidy is being reduced. So we think these firms are going to be very unlikely to respond to a reduction if they were hardly using the program in the past. So now I want to share a few tests of this strategy. We want to make sure that it kind of satisfies a few tests before moving forward. And one of the first tests with our strategy really focuses on this change in the subsidy in 2013. That's shown in the red vertical line on this chart. And so we want to make sure that there were no dramatic changes in claim volume around this time, which could suggest that there were either other things going on or other types of responses to this change in subsidy. But we can see it's fairly steady claim volume. It does go up and down, but it kind of follows this, we expect a little bit of variation over time. It's not going to be exactly the same. And it tends to follow a bit of a seasonal pattern and generally stays at a kind of constant level over time. Next, this chart shows that measure of exposure I described before. So it ranges from 0 to 1, where 1 means that every single claim at a given firm had some expenses reimbursed through EAP, and 0 means that none of the claims in a firm had expenses reimbursed through EAP. And what you can see is that we see, kind of a distribution throughout that range from 0 to 1. So there are some claims with relatively low use, and then there's a lot higher. There's a little bit of a gap above about 80%. But pretty consistent exposure and coverage in our exposure measure throughout the distribution. So we have that continuous measure, and then what we do in this chart is we essentially take that histogram and we clump it into 3 groups. So the bottom group here is sort of the lowest users with an average use of EAP of about 10%, and then the sort of middle range on that distribution is around 30%, and then the top third has an average use of about 50% of claims being exposed to EAP. And what we do here is we just look over time, how does this fraction change within these kind of exposure levels, if you will, before and after the subsidy change in 2013. You can see that the bottom chart with the lowest level has very kind of little change. It stays pretty flat. But then if you go up to the top chart, you can see that after 2013, that use of EAP tends to decline afterwards. So this is just suggestive. It's just kind of a raw exploration of our data, but it's consistent with seeing kind of a decline in use of EAP when the subsidy goes down. As one more test before we kind of finally move on to deriving some estimates, we want to understand how the characteristics of these claims look. And in particular, we're using this exposure measure as kind of a proxy, if you will, for actually looking at claims that used EAP and those that didn't. So what I want to really focus on in this chart is comparing the blue bars, which are our exposure measures. Here, we just cut it in half for the sake of presentation. So you can see the high exposure firms are those with the dark blue bars towards the right-hand side of each measure on the chart, and the light blue bars are those with the lowest exposure. And then compare that to those in the middle, which are actually the claims we see directly using EAP versus those that are not. And across the board, you can see that the high exposure group very closely matches the levels on a lot of variables. We just put a few on this chart, but we've checked others as well. So the high exposure group kind of seems to reflect quite closely what we see among claims in the EAP group. The one exception on this chart is that by definition, we're calling claims that use EAP as those that are accommodated. So of course, you can see there we're hitting 100% for the EAP claims, and we're not quite hitting that with the kind of exposure measure, but that's more of a mechanical feature of the way that we're defining the data here. So in general, this is just telling us that we think high exposure is kind of picking up a lot of the same characteristics of the claims that we see using EAP, which is something we want to see. I also mentioned before a little bit briefly, but so given that we have this exposure period, we have the exposure measurement period, and then we have our analysis period, this means that we need to see a firm in our data at least 2 points in time, one kind of when we measure that exposure and then another when we're doing the analysis. And so as a result, we don't end up using firms in our analysis where they only have one claim appear over the time frame that we see them in the data. So we just wanted to check and make sure that wasn't dramatically skewing our sample or changing things. It tends to be more common for them to slightly be larger firms and slightly more likely to be self-insured. Again, just it's more likely you're going to see multiple claims in a larger firm. So you can see now I'm looking at the light gray bar and the dark gray bar, which is comparing all claims and claims with more than 2 events or all firms, excuse me, and firms that we see more than 2 events in the data. But in general, this is kind of a reassuring chart that our analysis sample looks quite close to the sample that of all claims that we see. And our high exposure sample looks quite close to what we're seeing among claims that use EAP. So this chart here shows the results of the difference in differences analysis I was saying, essentially comparing how use of EAP or accommodation, as well as employment outcomes change after 2013 for high exposure versus low exposure firms. So looking at the leftmost column here called EAP, we can see that high exposure firms are about 10 percentage points less likely to use accommodation through EAP after 2013. The mean DV line there is showing the average across our entire sample. So a 10 percentage point decline corresponds to a decline of about a third relative to that mean of about 32%. Then we look at a series of employment outcomes. And for what we're showing here, we're focusing on 4 quarters after the time of injury. So about a year after the injury. And here we can see that, again, high exposure for claims in high exposure firms, they're about 3.3 percentage points less likely to be employed about a year later after 2013 when that subsidy declines. J to J here means job to job moves, or just basically changing the job that you are working at. And we don't see any change on that measure. Corresponding with the decline in employment, we do also see a decline in earnings of about $400 in that 4th quarter after injury, but we don't see any changes in the wage. So this is looking at 4 quarters after injury, but we are able in our data to look at multiple quarters over time. So next, I just wanted to plot out what this looks like over time. And the line here, the point estimate at 4 here corresponds to what I just showed you on the prior chart. And here we're just looking at the change in employment. And the main takeaway is that it's quite persistent. So we can see, about a year afterwards, there's still a decline in employment. And it increases slightly, but it's still, kind of fairly persistent, even 8 quarters after injury. So this change in subsidy is relating to fairly long changes in the likelihood of employment. So that's looking at the impact of the subsidy. And then next, we want to translate that into what does this mean of, what does the impact of accommodation have on employment? And so here, what we see, this is showing basically the impact of accommodation on any employment 4 quarters after injury, and then those same other outcomes I showed you, but all measured 4 quarters after injury. And the way to interpret this is that accommodation leads to about a 32 percentage point increase in the likelihood of employment 4 quarters after injury. Again, we still don't see any change in the likelihood of switching jobs. There's a substantial increase in earnings of about $4,000 and no change in the wage. So again, in the interest of an overview, I can't get into the details too much, but I do just want to pause here and say that these are quite substantial estimates. And the way that we're interpreting this sort of in the economist language, we would call it a late. We think this is a fairly specific result targeted at exactly those workers who are changing their behavior as a result of the change in the subsidy. So it may not be able to be extrapolated to every single worker who receives accommodation, but it's really focused on this. What we're identifying is people who are changing their employment outcomes as a result of this change in the subsidy. So it's a fairly targeted group. But we do some work in the paper to kind of look at what the impacts might be on other parts of the population. So, this exposure measure, you may have some questions. Oh, you could do it this way, or what happens if you change it? So we did a number of robustness tests where we changed the measure of exposure and defined it in slightly different ways. We also changed some sample restrictions, and across the board, the results broadly hold. So I'm happy to discuss those more, but in the interest of time, I'll just move on. And I just want to quickly touch on this second question of, do firms have appropriate incentives to provide the right level of accommodation? Again, I'll give you a quick answer. So our method here, we're going to use a structural economic model to understand this question. And the answer is maybe a little bit less satisfying. The answer is it depends. There's a lot of specifics of the population and the characteristics of workers that seem to matter, as you might expect. So this chart here just kind of visually explains the structure of this model that we're using. So, before an injury happens, workers are matched to firms and they're earning wages, and the firms are kind of buying this workers' compensation insurance. And then an injury happens, and then the workers can go down one of two branches. So they can either be accommodated, and in our data, we're, kind of treating EAP and accommodation as one and the same, or they can be not accommodated. And then they move into this injury period where you can see there's two possible kind of things that could be going on. If they're accommodated, they would be working and receiving wages. The firm has to pay for this costly accommodation, but together they're producing output for the firm. If they're not accommodated, then they have to stay in this period where they're not able to work and they're receiving a workers' compensation benefit, and there's no output produced to the firm. So this injury period happens, and then workers move into a post-injury period where they could either stay at the same firm where they were injured, they could move to a new firm, or they could move out of the labor force and not be employed. So those are the same outcomes, although if a worker is accommodated, then they could maybe have higher productivity in that post-injury period. So this is the broad structure, and then we can kind of think about changing the likelihood that each of these things happen. So change how likely it is someone gets accommodated, or kind of change the likelihood that they move into these different post-injury states, to think about sort of what the right levels might be for a variety of supports. And that's just at a high level, the broad structure of the model. So some takeaways, we do run these counterfactual experiments where we change things, holding the cost impacts of accommodation to be constant. And we find that on average, a wage subsidy of about 40% maximizes welfare for the average worker. So, comparing to that 45% that the subsidy was targeted at in Oregon, it's not too far off. But of course, there's a but. Impacts vary across characteristics. So, for example, what a worker's wage was before, or how the firm's insurance status is structured, all of those things affect kind of what the optimal level of subsidy would be. So the main takeaway is that the subsidies could be targeted, to specific types of workers who might be most likely to benefit or have the most to gain from this accommodation. So with that, I'll wrap up and conclude. I guess the main takeaways are, first, that we see accommodation is sensitive to employer incentives. So when that subsidy changed, we did see that there were changes in the rate at which these employers are using the accommodation program. The second main takeaway is that accommodation has long-run impacts on employment and earnings. So we saw these substantial gains in employment for a unique set of workers and substantial gains in earnings for workers who are accommodated. And then finally, from our model, we find some evidence that targeted accommodation incentives may be right to correct the level of accommodation for certain types of workers. So on average, it may be 40%, but there are some groups who likely aren't receiving quite enough accommodation, or maybe others where it isn't needed quite as much. And so it might be better to take a more targeted approach to hit that right level. So that's all I have. I'm really looking forward to hearing the discussion comments and the Q&A. So thanks so much for your attention. And I will pass it on to Seth.
Great, thanks, Stephanie. Really fantastic talk. Really enjoyed it. I will start off my always great. I'll start off my comments with an apology. I actually, I guess when I was preparing my comments today, I was working off an older version, which was more about a descriptive piece on. See if I can advance the slides. A descriptive piece about describing what claims involved accommodation. So I didn't see some of the newer work, which I think is great. So my slides may not totally line up well with my comments, but I'll try to respond to the work that was done and the policy implications of those. But if anything in my slides looks like it's not relevant, I apologize for that. I just wanted to start off talking about why this is such an important area. When we think about, especially from a policy perspective, right? When we think about accommodations as a policy topic, we're typically thinking about the ability of accommodations to improve return to work for injured workers. While the workers' comp system can be quite contentious in general, return to work is one of these topics that's generally considered a win-win for injured workers and employers. Employees can benefit from lower earnings losses, less job disruptions, possibly better health outcomes. I'd say the evidence there is mixed. But employers can certainly benefit from lower workers' comp costs, lower rehiring costs, retraining costs. So it's something that in general we think is good for both workers and employers. But that raises the question of what's the policy problem then, right? If it's something that's a win-win for workers and employers, maybe it's something they can work out on their own, and it leaves a question about the extent to which there's really a policy problem that needs to be solved. And so the barriers to return to work come from a couple of places. One is, despite the fact that it's intended to be no-fault insurance and lower disputes, the workers' compensation system in many ways remains a very adversarial system, and there are conflicting legal agendas that can result and processes that can provide a barrier to return to work. And then there are questions, as Stephanie alluded to, about the extent to which employers and workers are actually working together to identify appropriate work limitations and reasonable accommodations. Basically, are employers doing enough to accommodate injured workers? I think that's the real question for policymakers that's being addressed by the current study. So when we talk about accommodations, what is it that employers are actually doing? This is some work that from an older study that we did at RAND, some findings where we actually talked to 40 large self-insured employers and asked them basically what they were doing in terms of accommodating injured workers and trying to bring them back to work. And so this is California, unlike Oregon, is a state that doesn't directly incentivize return to work programs, or certainly not at the time that we did the survey. And so the only incentives are those that are inherent in the system. The fact that these are large self-insured employers, they bear the workers' comp costs. So if there's a way to alleviate them, they have incentives to do so through that. And when we talked to employers, we found that, in fact, most of them were doing at least something to accommodate injured workers. So we asked about a bunch of activities that employers could do. One is providing modified work tasks, so changing the activities of the job that are required, modified workstation or equipment, so more physical modifications to the work site, scheduling changes, accommodating reduced time or different schedules, and then actual, I think this is what Stephanie referred to as J to J, changing the job. And so, modifying the activities is probably the most straightforward, lowest cost intervention the employer can do, and not surprisingly, they were done quite frequently. Only 5% reported using rarely or not at all. And then the other more involved accommodations were done much less frequently. So modified workstation equipment, reduced time, all of those things were done just fairly frequently. And then actual job changes, relatively uncommon, even though these are all very large firms. So these are thousands of workers, they have some ability to move people across. So when we think about what a group of large self-insured firms, a lot of them are taking steps to accommodate workers already just based off of the incentives that are embedded in the system. And when they do so, we tend to think that there's some benefit to injured workers. So, we asked about a similar approach in terms of we had some information on the date of when the firms adopted the program or not, and we saw that sort of within firm changes in adopting a formal return to work program that involved, policies to return to work coordinators, things like that. We actually saw significant reductions in time out of work, particularly centered in the permanent disability cases. I want to run through these quickly because basically these results are consistent with what Stephanie found, in that return to work accommodations can have a significant impact on employment opportunities for injured workers. And what we found was that California employers were doing this at relatively high rates. And large self-insured employers. So I think that the real fundamental question and the policy question here is are firms doing enough of this? And should firms be doing more? And if so, which ones? So looking at this again, this slide is based mostly off the more descriptive paper. But I think there are some legitimate questions still that I think are important to answer, and I think look forward to seeing Stephanie's work in this as they go forward. It seems like the EAP, the EAP program, which subsidizes employers for accommodating workers to bring them back early, it seems like it was more commonly used by large self-insured firms, at least when we look at a claims level data set. It seemed like it was more commonly used in professions where workers have better job security. When I looked at the characteristics, it would seem like more educated workers on average, probably higher wage workers, were more likely to receive the accommodations. These firms were, it seemed like they were mostly taking the wage subsidy. It seemed like relatively uncommon that the money was being used to do any of the other things like work site modifications, things like that. And so I think this raised a question. I think that the work here presented actually helps answer. The question is, to what extent is the work promoting meaningful return to work? The program, in the sense that was actually changing employer behavior in such a way that they were bringing people back that they wouldn't otherwise, or are they simply subsidizing employers for behavior they would already be doing? And so the findings that Stephanie presents suggest that actually, indeed, there do seem to be meaningful improvements in return to work associated with the subsidy. And so I think that, helps, make the argument this is good for workers. This can actually lead to sustained employment in the long term. So I think that I'm going to skip this last part, but I do think there's some questions remaining about exactly which firms are offering accommodations, what are they doing, and what should they be doing. So just some questions that I had, and some of which I think I still have after seeing the updated work. I'm going to skip the first part since we were only talking about the EAP program anyway. But I would like to understand, I think, some more firm-specific analyses. One of the data that were used in the earlier version of the study that I saw were a claims level data set, right? So looking at the workers' comp claim level, which is important, but it's more representative of sort of a randomly selected injured worker. But when we start thinking about firm level decisions, it's useful to think about a firm level analysis because they're not necessarily going to tell you the same things, right? Most workers work at a large firm, but most firms are small, right? And so when you look at a claims data, you're going to see workers from larger firms more frequently. So it'd be really interesting to look at a firm decision level making, if we look at firm level data and stratify by size and industry, to what extent do we see the use of EAP vary at the firm level? So a firm level analysis, I think, would be instructive here and help understand better, how to target specific firms and maybe better understand what they're doing. And I think that this relationship between firm size specifically is interesting, and I do think it's relevant for the analyses presented today. Stephanie mentioned that they need to see a firm in the data set at 2 points in time, which is, I would say, in my experience, that's significantly more likely at a larger firm. So understanding the firm, looking at the firm level data, understanding the distribution of firms that are in the data before and after employing this restriction, I think would be helpful, because I am wondering if what you're really looking at is the marginal impact of the subsidy on large or maybe large to mid-sized firms, and understanding, and so the average treatment effect that they're finding, the latest Stephanie called it, really is reflective of firms that are of a certain size range that probably have better ability to do accommodations than smaller firms. And it's like, I would think that by requiring 2 workers' comp claims over a time period, you're probably losing a lot of very small firms and a lot of firms that churn, right? Like there's a lot of firms that exit in a given year that you may not be able to track with this. So just kind of better understanding the profile of firms that are included in the data, I think, would be really helpful. And then there is a very robust structural conceptual framework in the updated study that I didn't get a chance to read through in detail. But some things I think that'd be useful to understand is a little bit more about the types of accommodations and what should and shouldn't be subsidized. Because I do think that some accommodations probably involve fixed costs, right? Setting up a program or policy or something that could potentially impact the worker multiple workers, where some are going to be more variable in nature. And I think particularly from the standpoint of a wage subsidy, the extent to which these accommodations could or could not be impacted, my intuition is that the welfare implications might differ. And so understanding that better, and I think understanding more about the actual firms and understanding what the firms are doing would be really helpful for answering the question of should we be subsidizing more accommodations, and if so, for whom? Because if it's small firms that are simply unable, they just lack the ability to offer some of these accommodations. Like a small firm with 3 employees probably can't offer a J to J transfer for a worker, right? So just understanding kind of what the feasible set is across different firms would be really helpful. And so that's all my comments there. So I will happily, pass to Mara.
Very interesting research indeed. This is Marcy, and great insight into the research, Seth, and some very good questions. I just thought I would start off by sharing who I work for, which is Great Lakes ADA Center, which is part of the National ADA National Network that provides information, guidance, and training on how to implement the Americans with Disabilities Act in order to support its mission to assure equality of opportunity, full participation, independent living, and economic self-sufficiency for individuals with disabilities. The network is funded by the National Institute on Disability, Independent Living, and Rehabilitation Research, otherwise known as NIDLR. And the network consists of 10 regional ADA centers located throughout the U.S. and an ADA Knowledge Translation Center. Our service area is designated as Region 5. It covers Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. We are not an enforcement or regulatory agency, but a helpful resource supporting the ADA mission. And as such, we conduct research projects to improve the understanding of ADA implementation. We serve individuals with disabilities and covered entities such as employers. We provide technical assistance on the ADA and other disability-related regulations. We design educational materials, provide trainings tailored to customer needs, as well as several monthly webinar series covering a variety of topics. And folks can stay connected and up to date on disability matters by following us on social media. We're on X, Facebook, LinkedIn, Instagram, and YouTube. So now that you kind of know who I am and where I come from, I'd like to just go over the many practice pitfalls that I have seen, and we get TA calls regarding the success of accommodations in the workplace. The first is that there are different definitions and interpretations of the terms disability and accommodation. People think different things when they hear the words disability and accommodation. Many older adults don't tend to think of themselves as having a disability when the impairment is or assumed to be a result of the aging process, such as arthritis, for example. As a result, older adults do not think to ask for accommodations because they assume dealing with age-related impairment issues is part of getting older, and often are unaware of available resources and don't take the time to look for them. Some individuals with new impairments have only heard the term accommodation in relation to hotels. I do get TA calls like that. Different generations have different interpretations on these terms as well. There's also the issue of how different benefits such as workman's comp, short-term, long-term disability define these words, which don't always match what the ADA says. A second pitfall is confusion between benefits such as workman's comp, short-term, long-term disability, and civil rights laws such as FMLA and ADA. There are so many different benefit programs along with civil rights laws that individuals get confused with each one, especially if they're utilizing more than one and working with multiple people or entities to access these benefits and civil rights. And sometimes they're also working with state agencies such as vocational rehabilitation services. And so employees get confused as to what's going on and what they need to do, what paperwork needs to go where. They don't understand also that short-term, long-term disability don't protect your job like the ADA, the differences between these benefits and civil rights laws. Another pitfall is stringent and overly complicated procedures and processes, or not having any at all. Employees' internal staff get even more confused when they are strict and complicated procedures regarding benefits and civil rights, especially if there's no procedures, which does occur, especially with those smaller firms that you were talking about, Seth. And when a process is too strict, then simple solutions get overlooked by people overthinking the process, which can result in employees having to jump through unnecessary hoops to access benefits and one's rights. That happens more than you would think. A big pitfall is poor or lack of communication between employees and internal staff. So employees struggle to find out who they're supposed to work with regarding benefits and civil rights and how to connect with them. If they can connect to the correct person, the person typically only responds by email, which further breaks down the communication. Additionally, internal staff often do not take the time to explain the benefits and or civil rights to employees in a plain language way, and that's and if they do not continue to explain these options over time, which is important because when someone is injured or acquires a new disability, there's a lot of stress there. And when you're stressed, it takes more brain power to compute everything. It's a lot of information being thrown at you. And so even if you told an employee something, it might take 3 or 4 times to say it before it sinks in, because they're going through a major life change many times. And so by not providing this information in plain language on a consistent basis can further confuse matters. Another issue is that internal staff managing these benefit programs do not communicate with each other or their FMLA and ADA personnel. Internal staff typically don't think to refer an employee to an additional appropriate benefit or to their ADA person. These silos create missed opportunities and productive collaboration that would lower an employer's bottom line and increase the retention of valued employees with disabilities. A growing issue is when an employer outsources their benefits or civil rights obligations to a third party, which creates a lot more confusion and communication issues. So many employers mistakenly think that when using a third party to manage many of their HR functions, they're no longer on the hook for compliance, especially with ADA accommodations. And I've taken many TA calls from employees who are experiencing communication issues as an employer defers to their third party who is managing FMLA, and then maybe their workman's comp, and then it's maybe another third party that's managing ADA, and sometimes it's not the same third party. So then you're having all these different processes, and employees, again, they're stressed, they're forgetting who they talk to and who does what. And many times those third parties are only communicating by email, making the employee more frustrated and further from receiving necessary employment support. And if they do receive it, it's not always timely. Tunnel vision is another practice pitfall. Benefits and civil rights should be occurring at the same time to maximize resources. As I said, employers don't think about the ADA until after workman's comp case is closed, and many times do not even consider the ADA. Employers should be connecting and working with the employer on all fronts at the same time. An employee can have a workman's comp case and be pursuing ADA accommodations, especially if the injury has resulted in permanent work restrictions or permanent disability. Job reassignment under the ADA is sometimes overlooked as well. Then there is underestimating an employee's capacity to return to work. So employers and employees can both underestimate the employee's overlooked capacity to return to work. This goes back to tunnel vision and only looking through one lens or listening to one voice, or the inability to think outside the box and other ways of doing tasks. The Job Accommodation Network, otherwise known as JAN, has an A to Z of disability and accommodation, and it's a great place to start to get the brainstorming process going. The last practice pitfall I want to address is overlooked advantages such as tax credits, costs, and benefits of accommodations. According to a study by Jan, about half of all accommodations cost nothing. Of those accommodations that do incur a cost, typically a one-time cost, the average expense is about $300. According to the employers Jan surveyed, accommodations generally resulted in the benefits to the company, such as reduced insurance and training costs and increased productivity and morale. Many business owners and employers are unaware of the tax incentives available to encourage compliance with the ADA, such as IRS Code 190, Architectural Barrier Removal Tax Deduction, IRS Code 44, Disabled Tax Credit. And now moving on to some best practices. The first is flexible procedures and processes. So it's important to have some type of process to ensure equity, and it should be flexible to avoid falling into the pitfalls I mentioned earlier. When I worked for a larger employer, I worked with my HR colleagues who handled FMLA, workman's comp, and short-term, long-term disability, and creating an internal flow chart so that my colleagues knew when to refer an employee to me for ADA accommodations, which resulted in many more employees with disabilities retaining employment and thus utilizing our resources more wisely. And another best practice is continuous education and training with supervisors and employees. It's not a one and done. So this is key to address turnover and employees acquiring new injuries and disabilities who now may take notice of this important information. Additionally, people learn through repetition. If both sides of the table are educated and encouraged to discuss accommodations, they will do it. For example, while working for a large employer, I created a workshop on the ADA and the employer accommodation process, which leadership mandated. As a result, accommodation requests increased by 400%. Additionally, more supervisors were recognizing employee needs and calling me for guidance. Items to cover in training include definition of terms such as disability and accommodation using that plain language, policies and procedures, benefits, programs, civil rights, and who to contact and how. Maintaining ongoing communication between supervisors, employees, and internal staff, that's your HR folks, benefits programs, equity people, is key. Don't just rely on email, as this form of communication often gets misread and misinterpreted. It's really important to pick up the phone and meet in person, use email to recap verbal conversations. Lastly, periodically evaluate the effectiveness and/or desired outcomes of policies and procedures, especially when there's significant changes such as the COVID pandemic and restructuring of a department. You want to ask, do any policies contradict any of your benefits or civil rights laws? And do your procedures still make sense? I saw a lot of this during the COVID pandemic with our TA calls. Well, this concludes the practice implications, and I now turn it back over to Jonathan for a Q&A.
All right. Thanks, everyone, for those great presentations. I'll invite Stephanie, Seth, and Marcy to remain on camera here because we do have a little bit of time for Q&A before we close our session. So I usually like to start this with providing the researcher person representing the research team an opportunity, if they would like to respond to any of the comments made by the discussants, and if they see there's anything that they would like to address or say in response to some of the comments about possibilities moving forward. So Stephanie, I'll give you that opportunity.
Yeah, thank you both. I really appreciate both of your feedback and comments. It gives us a lot to think about to kind of set our study in the right context. I'll go in reverse order because Marcy's top of my mind. But you mentioned all of these complex kind of interactions and how they, it's hard to keep track of them. And one thing that we were thinking about in our study is, like what, and maybe this is just part of the kind of confusion around this, is like, would these accommodations be provided, like be required under ADA or not? And in our review of that, it looked like, there's a fairly high bar, if you will, of the definition of disability that like qualifies someone for the ADA. And what we had read is that a lot of times these workers' compensation injuries don't necessarily meet that bar because they're more temporary. And so they could kind of fall through the cracks of protections in the ADA, I guess. So anyways, I don't know if you have any comments on that, but it was something that came to mind when we were thinking about, you mentioned these two players or all these different things, and it's something that we had thought about too when thinking about, is it just going to be necessary that this accommodations provided, or would there be a reason for us to even see a change here?
Yeah, that's why we created an internal flow chart of my HR professionals, because when an injured worker had permanent work restrictions or permanent disability, that's when I was like, that's when you need to start referring them to ADA, because if an employee comes to work with permanent work restriction, that note in and of itself is a request for accommodation.
Mm.
Because now they have permanent work restrictions that may have implications on their ability to do their job and may need accommodation under the ADA.
Yeah.
So you're right. So not everyone in workman's comp would qualify. That's why I created a flow chart for my workman's comp colleagues to know when the ADA process would be triggered within that process. And so then, because they were slipping through the cracks, there were individuals slipping through the cracks that could be using both processes to come back to work. And knowing who to talk to, I mean, that's the other thing. Employees just get so confused and overwhelmed. And your definition of accommodation is pretty much what the ADA is, but it's the definition of disability that's different, right? So that's the other thing, is that confusion and understanding what they do. So people will call me about benefits thinking it's a civil right, and I'm having to explain the difference between benefits and civil rights. And so and employers just forget, it's very overwhelming when you inquire a new injury or disability or illness, and having to go through all these processes and jump through hoops. And, well, you don't talk to me, you talk to this person, and, oh, that wasn't us, that was this group. And it's a lot. So if there's a way to streamline these processes and plain language, I think that would really show a lot of improvement too for workers returning to work.
I'm sympathetic to that. I don't know that we can offer much on this, like evidence on the streamlining, but I do think it's really important in a lot of contexts. And Seth, thank you as well. Sorry for the confusion with the paper versions and everything, but I do think, I mean, your comments like totally resonated with things we've been thinking about. So I really appreciate that. And just wanted to mention on the like firm level analysis, I do think that would be really valuable. And I mean, we are limited in the structure of the data that we just see things at the claim level. I will say that we tried to compare, or we definitely compared along a number of dimensions to the entire sample that we see, and then those when we limit to seeing the firm at least twice. And I mean, as you'd expect, the firm characteristics change a lot, but actually the worker characteristics don't change dramatically in a lot of respects. I think that's probably kind of the other thing you said is, most workers are in large firms. And so we lose a lot of small firms, but it doesn't actually exclude that many claims from our data set, if you will. So I don't know if that's a pro or a con. It's definitely a bit of a limitation for being so interested in the firm side that we only see firms when they have a worker experience these events. But yeah, no, thank you. It's good for us to do. It's a good idea to kind of look at that more carefully. And definitely it seems, and I think this is in what you read, the firm characteristics are definitely the most important drivers of accommodation. We really don't see much like worker characteristics. We thought even injury type or things like that might be important drivers, but it really seems to be coming from those firm variables. And that's playing out in some of the simulations that we're looking at in the model too. So.
All right, thanks for those comments. Since we just have a few minutes left, I'll just pose one question that's broad in nature, but I'm curious to get you all's thoughts here, as someone who doesn't have nearly as in-depth of knowledge of as you all about this. But I'm curious if there is, based on what you all have seen, a relationship between the quality, and you get to determine the definition of that, the quality of the employer's health insurance program and paid leave program, as it relates to the quality of their accommodation programs. Have you all seen anything like that? Like, does it come up very often where you see like an employer, large, small, in between, that has a really, really strong health insurance and paid leave program, but not accommodation? Or is it, I'm just curious, it's a very broad question, but I'm curious what you've seen.
I don't know that we have looked at that directly. I think, I'm thinking of something Seth mentioned in his comments, which is, like large firms, I think at a baseline just have a lot more capacity to do all of these things. So I would not be surprised if that were the case, that large firms that can offer a lot of benefits are also just set up to provide accommodations. And maybe they don't even have to, do a lot of extra work to make those accommodations possible, because they could have other jobs people could do, or they could have, different work settings and things like that kind of already as a part of the
Mm.
fact that they're large and they have a lot of people. So I would suspect that's the case. We don't see in our data, it's just limited to the workers' compensation and accommodation scope. So we don't see things like their health insurance system of the firm or other characteristics of the firm, unfortunately. So I can't speak directly to it, but it seems reasonable to me.
I would add to that what I see in the experience is kind of what you were talking about, Stephanie. It's not so much what kind of benefits they have, it's the size of the employer. So if you're a larger employer, like a university, for example, they have lots of like ergonomic programs that they have access to, right? Where a smaller employer doesn't have like an ergonomic program. And so they have more resources available to them, and including usually a legal team, and ensuring there's policies and practices in place and education on these policies and practices. Smaller employers don't have as much resources to provide that information and education and have those resources. So I haven't really seen a correlation regarding insurance versus able to provide the accommodations.
I think empirically, I think a lot of it too, it depends on what type of, even within a firm, like what type of job, right? Like employers tend to dedicate the best benefits to, employers to workers that they have a greater desire to retain. So there's, I think, a strong, desire to retain and invest, willingness to invest in workers. I think even within the same firm, you'll see variation in that where some firms are not treating all workers the same.
Yeah, those are great comments and really helpful. I could go on and on about this because, as you all mentioned, like the size of the employer, I'm wondering like where that cutoff is. Is it like our standard definition of what a small employer is with 500 employees, or is it something different? Anyway, we're out of time, so we won't be able to get into all those details. But I do want to thank you all for being here, and all of your contributions to this webinar. It's been very, very helpful to learn more about. And to all of our attendees, just a reminder that this webinar will be posted on our website by the end of the week for sure. And so thanks again to everyone who attended, and especially to our very knowledgeable presenters today. And I hope you have a great rest of your day. Bye-bye, everyone.
Bye-bye. Thank you all.
Bye.